So before I start my presentation, I'm going to tell you guys a little about myself. So back at home, my mom never lets my siblings and I drink real cow milk. So it used to be weird, but she's been doing it for 3 to 4 years now. We only ever drank almond milk, soy milk, and silk milk. I've always just brushed it off because I figured she's had her own reasons. But after researching for this presentation, I've realized that one of those reasons may have been she didn't want us to become infected with Staphylococcus aureus. Many of you know that irritating thing that everyone gets once in their life, known as food poisoning. Well, along with a lot of other bacteria that causes food poisoning, Staphylococcus aureus is right on that list. Hi, my name is Adesokan, and the disease I will be talking to you guys today about is Staphylococcus aureus. This is more of a bacteria than a disease. It causes diseases and other health problems. Today we will be talking about the discoveries, background, risks, transmissions, symptoms, outbreaks, mortality rates, causes, miscalculations, an experiment, and an interesting fact. Staphylococcus aureus has many negative ripple effects. It is like any other bacteria, but infection with it can go from having mild problems to severe problems. Discovery. In 1880, a German scientist by the name of Sir Alexander Adesokan discovered staphylococci in pus from a patient's knee joint after surgery. When he described the bacteria, he said the masses looked like bunches of grapes. Many of you know from Wet Bench that the bacterial morphology term coccus means circular, so Staphylococcus aureus is a circular gram-positive bacteria. The strains of Staphylococcus aureus produce a highly heat-stable protein, which is what causes humans to become sick. The aftermath of becoming infected with Staphylococcus aureus is skin infections, respiratory diseases, and food poisoning. Some skin infections that are results of becoming infected with Staphylococcus aureus include boils, impetigo, cellulitis, and staph-scaled skin syndrome. When dealing with patients that have been infected with Staphylococcus aureus, doctors must acknowledge a person's general health before infection, how much of the infected substance has been ingested, and the amount of bacteria on the substance or material. Many factors can increase one's risk of getting infected, especially when diabetes, HIV and AIDS, kidney failure, a weak immune system, cancer, skin damage, and respiratory illnesses has been in their past. Transmissions. This bacteria can be spread in any type of environment. The two main environments it's spread in are medical facilities and in your everyday life. In a medical facility, this bacteria can be transmitted through urinary catheters, feeding tubes, breathing intubations, and intravascular catheters. There are many common ways this bacteria can be transmitted in everyday life, such as sharing personal items, cuts and wounds being exposed, and poor personal hygiene. This bacteria likes to live on inanimate objects such as pillowcases and towels. It can stay on these objects long enough for someone to come in contact with it and then become infected. Ordinary symptoms. Some ordinary symptoms of becoming infected with Staphylococcus aureus include developing abdominal pain, violent vomiting, and severe fever. These symptoms are mostly for food poisoning, some more specific symptoms include skin infections, food poisoning, toxic shock syndrome, septic arthritis, pneumonia, and bone and joint infections. Outbreaks. In 1983, there were 127 outbreaks and 7,082 cases recorded. On October 1st, 2014, a Swiss boarding school became contaminated when 10 children and 4 staff members consumed cheese with raw cow's milk in it. Mortality rate. About 100,000 people a year become infected with Staphylococcus aureus. About 10 to 30% of these people actually die. Some causes in production of Staphylococcus aureus include food handlers improperly handling food and possibly skipping any mandatory procedures they need to go through. This can result in the bacteria ending up on their noses and hands, and then our food that they're dealing with becoming contaminated. Also, storing foods in the wrong conditions. One example of this is if a food needs to be stored in a cold temperature and it's put in a warm temperature, then the bacteria can start to develop on the food. And lastly, the ingestion of bovine milk, raw milk, and soft cheese. Many people miscalculate and underestimate the severity of Staphylococcus aureus. This is because of misdiagnosis, unreported minor outbreaks, which means that if someone gets infected, or a few people, or there's an infection going around, no one really pays attention to it. Unsuitable sample collections and unsuitable laboratory examinations. Both foods and animals are able to become contaminated very easily. Some animals that often become contaminated are dairy cattle, sheep, and goats. Some foods that often become contaminated easily are meat products, poultry, eggs, and dairy products, salads, bakery products, pastries with cream fillings, and sandwich fillings. The purpose of the experiment I found was to see what infection with Staphylococcus aureus could do, involving further improvement for neurodegenerative illnesses. These neurodegenerative illnesses include ALS, Parkinson's disease, and Alzheimer's. The hypothesis in this experiment was that extracellular adherens protein is responsible for the protective effect of Staphylococcus aureus in EAE. EAE is experimental autoimmune encephalomyelitis, and EAE is usually the human model of brain inflammation, but in this case, it's the animal model of brain inflammation. It is also a disease where the central nervous systems, the fibers in there, are destroyed. There were 62 brown female rats, they were about 8 to 10 weeks old, and these rats, the scientists set up persistent chronic infections in these rats, then they were purposely infected with strains of Staphylococcus aureus. The results showed many positive things, particularly that infection with Staphylococcus aureus reduces the neuropathological dame of the optic nerve and increases retinal ganglion cells survival after acute optic neuritis. Acute optic neuritis is the brain inflammation and the swelling of also the nervous system, and this can result in temporary loss of eyesight. This experiment proved that for the first time, infection with Staphylococcus aureus reduces autoimmune inflammation. So this proved their hypothesis wrong, because at first they thought it wasn't going to work, but it ended up working in the end. One important fact that I found was that a new bacteria called methicillin-resistant Staphylococcus aureus was found in homes. This bacteria at first they tried to kill this bacteria with penicillin, but once they tried, it was so strong that penicillin couldn't kill it. Then they tried to kill it with methicillin. Methicillin also didn't kill it. So you could see how this could be an issue, because many people discovered it in their homes. In conclusion, I hope I have explained the details of Staphylococcus aureus, the health issues it causes, transmissions, an experiment, an interesting fact. I hope I have, one tip I want to leave you guys with is don't go around eating random foods such as milks and cheeses, especially if you don't know the expiration date, if you don't know where it came from, and if it has been expired. Thank you. Any questions?
Questions for Alexa.
Corey.
Hey.
You said something about ALS. What does that stand for?
You know the ALS Ice Bucket Challenge? All I really know about it is that it's a disease where your whole body kind of freezes up and is paralyzed, but I have to do further research to answer your question. Ahmad? I'm not sure how many rats died, but I think a couple of them died from maybe like the infection with Staphylococcus aureus may have killed them. Chris?
Okay, so in your experiment, you said that there's this like abbreviation called EAE or something like that. What does that stand for again?
Experimental autoimmune encephalomyelitis.
Thank you.
Oh, Aslam?
You were saying it's transmitted through, you kept saying raw cow's milk? What
Yes.
exactly do you mean by that?
Like it hasn't been cultivated right maybe, or
Jazz hands.